According to the CDC, someone has a stroke every 40 seconds. And here in New Mexico, heart disease is the #1 killer of residents. Despite these harrowing statistics, 80% of strokes, they are preventable. And now that's what National Stroke Month is all about. Joining us this morning to help us learn how we can be aware of the issue, we have Dr. Robert Taylor, who's a cardiologist from Optum, New Mexico, along with the executive director for the American Heart Association, Miss Sherry Wells. Welcome to you both.
Thank you. It's great to be here.
Thank you for having us.
It's great to have you both because not only just for the Stroke Awareness Month, but alarming stats that we're seeing there. So the more that we can get the information out to everybody in the public, the better. And so let's kind of talk about a stroke. What causes it? How does this happen?
So there's two types of strokes. There's an abruption of the blood flow to the brain. That can happen from an injury to the artery or from a blood clot coming from the heart or from somewhere else in the body. Then there's just bleeding into the brain. Both of those are medical emergencies. You have to be seen very, very quickly. If you have a blood clot that goes and abrupts an artery, if it gets fixed or the blood is thinned within 60 minutes, you can have good recovery. The longer you wait, the less likely it is you can have a good outcome. So it's very important for people to recognize the symptoms of stroke, like headache, visual changes, changes in your verbiage, so you try to talk but you don't make sense, maybe not being able to use your arms, not being able to walk steady. Sometimes it's confusing to the patient because the abruption makes them just not aware of their surroundings, so it's often picked up by the people around them. Why aren't you making sense? Why are you walking so funny? What, things of that nature. But once it's recognized, you must come to the emergency room. Unfortunately, a lot of people wait. So what happens is they start having symptoms and they may say, well, let me lay down and see if it goes away. Well, you don't want to do that because, again, the treatment has to be very quickly. You have to go to the emergency room. You have to call the ambulance.
Yeah. Time is of the essence when those things start to happen because, and I've seen it, when there's somebody's in the emergency room, the tests that they make them go through just, see the symmetrical if there's kind of like starting the early effects of those, the symptoms there. But again, there are treatments for this. What are we looking at preventative-wise?
So preventive-wise is just looking at the risk factors. So I'm a cardiologist, so many of the risk factors cross over. So we think about heart disease with hypertension, diabetes, obesity, high cholesterol. Those are the same risk factors for heart disease as it is for stroke. However, it's stroke month, so we really want to focus on that because we focus so much on heart attacks, and I think we've done a good job at that, but people really aren't aware that some of the prevention crosses over. So that's why we're very aggressive at checking blood pressures, we're very aggressive at lifestyle changes. So 4 out of 5 strokes can be prevented if you intervene early enough. So this is a preventable disease.
Yeah. And getting the word out there, Sherry, let's kind of talk about what that is for the American Heart Association.
Well, as Dr. Taylor said, we focus so heavily on heart disease, which is the #1 killer, but stroke is the #5 killer of people. And so we use this month, and then we use November is National Stroke Awareness Month to, again, just talk to people and talk about the same thing Dr. Taylor talked about, the symptoms, recognizing it, and 80% of strokes can be successful outcomes. But again, people don't act fast, and they don't recognize the signs.
And Dr. Taylor, I mean, family knowledge of family history. I mean, that's important as well, right?
Yeah, for heart disease, knowing your cholesterol, if you have diabetes, you're at much higher risk for developing diabetes yourself. And it's very potent because just lifestyle changes can prevent a lot of the things that we're talking about. Obviously, we check blood pressures, but even things as far as exercise, diet, eating more fruits and vegetables, eating more potassium in your diet, less salt, just simple things like that can lower your blood pressure 10%. If you are at risk for a stroke, a 10% drop in your blood pressure can lower your risk of having a stroke 25% right off the bat. So that's just doing lifestyle.
Yeah.
And then if the cherry on the sundae is treating the blood pressure, and if you have diabetes in your family, making sure you screen for that. Knowing your numbers, your cholesterol, your blood pressure.
Monitoring that as well, a blood pressure machine is something that somebody can have access to as well, right?
Yeah. We actually have one right here.
Oh, there you go.
Yeah.
There. Yeah, so
this is a simple blood pressure machine
Okay.
that you can buy at CVS, Walgreens, any pharmacy.
Okay.
And it's easily done. The blood pressure machines have gotten very good, so they're almost as good. The standard for blood pressure is actually in a doctor's office, the mercury cuffs that you see, that you get your blood pressure. But these are very good. And one of the things that's happened over the last 5 years is we're trying to concentrate more on the blood pressures people get at home and not so much on the office, because some people come into the office, it's an unfamiliar circumstance, environment, so your blood pressure may be artificially elevated. So we're relying more on this, and so this is something that you can invest in for $30 to $50.
There you go.
They last 3-5 years, then you have to get a new one. They need to be calibrated over time. But doing this, you really are ahead of the game.
Yeah. And again, something to be aware of, and another preventative source to make sure that you don't become a victim of these afflictions right here. So we're running short on time. Web address where we can find more information.
Heart.org.
Okay. All right. Thank you both for joining us. We appreciate it.